Senior supportive living and long-term care facilities are often viewed in two different perspectives, either a clinical setting or one that's serene, where the occupants are living out their remaining years in peace and quiet. However, looks can be deceiving. The outward appearance of this work setting may look harmless, but believe it or not, healthcare workers in these facilities run the risk of injury if they're not exercising caution. In fact, 6% of all full-time equivalent employees in the workforce in Alberta are healthcare employees. This includes healthcare aides and nurses. Not a large portion of the workforce, but they are collectively responsible for almost 20% of the overexertion injury claims in Alberta and responsible for 13% of the fall injuries. And 83% of all workplace injuries across all sectors involve a healthcare worker and a resident or a patient. So the importance of conducting a point of care risk assessment cannot be underrated. It should never be dismissed as a waste of time. An informal hazard assessment, which is utilized in every industry in an ongoing process where workers are constantly surveying their surroundings, equipment, and the materials they're using to note the possibility of emerging hazards. In the healthcare setting, this type of hazard assessment is called a point of care risk assessment. A point of care risk assessment will take into consideration the resident's previous history, right up to the point of entry into the room or point of care. The point of care risk assessment starts prior to entering the resident's room. The caregiver will ensure that he or she is composed and ready to perform the tasks ahead of them. This means a self-check, asking themselves, how am I feeling? Am I ready to perform this task? Do I need help? After knocking on the door, the assessment continues by their caregiver listening to the reply. The characteristics of it. Is the voice loud and clear? Perhaps it's shakier and quieter than usual. What about the content in the reply? Is it the resident's usual self, or do the words sound cranky or angry? Based on the response, this would be the point where the caregiver again would consider if they should provide care on their own or go and get help before entering the room. If the response from the resident does not sound unusual or out of character, the caregiver can enter. Upon entry, the caregiver will continue the assessment by scanning the room and noting the characteristics of the room. Is the entrance to the room clear and free of tripping hazards? What about the floor? Is it clear of any hazards that might cause a slip or trip? As the caregiver approaches the residence, they will call out and note the response from the resident. Is the resident communicating in a normal manner for them, or are they behaving erratically? What are the movements like? Do they appear defensive, or are they behaving like they're frightened? It is important to understand when conducting a point of care risk assessment, the caregiver can at any time remove themselves from the situation and get additional help. As they approach the resident, the caregiver will continue communicating with the resident or working to establish whether it's safe to proceed with the care or not. As mentioned earlier, caregivers in long-term care and senior supportive living are susceptible to both violence and soft tissue injuries, and most care provided for these residents will involve some sort of physical contact. If the resident's care plan states that they should be assisted by a single caregiver to stand or transfer to a chair, but the resident's not lucid or they are not behaving normally, a single person transfer should not be attempted. On a similar note, if the resident's care plan is stated they tend to lash out if they're not fully awake and are prepared to be approached, this also poses a risk of harm to the caregiver. Once they've established the resident is behaving normally and acting according to the condition for care as it's laid out in the care plan, their caregiver can begin to provide care. Let's look at this scenario. Caregiver assigned to look after Mrs. Resident. Mrs. Resident will need help getting dressed and coming to breakfast. Mrs. Resident is able to assist with the one-person transfer into a wheelchair provided a transfer belt is used. However, when reading the care plan, the caregiver notes that a week ago, Mrs. Resident complained she didn't need the transfer belt. It was uncomfortable. She even pinched a fellow caregiver enough to leave a bruise. The care plan said this was an isolated incident and hasn't been repeated since. The caregiver made a mental note of the incident and will be considerate of this during her interaction with Mrs. Resident. Proceeding to Mrs. Resident's room, the caregiver did a quick self-check. No physical issues noted. She felt pretty good. Plenty of sleep the night before, and nothing distracting her attention this morning. After a knock at the door, Mrs. Resident's cheerful voice invited her in. The caregiver noticed the room was tidy and neat as usual, the floor was clear, and there didn't appear to be anything amiss. As the caregiver approached Mrs. Resident, she called out and said she was here to help her get ready for breakfast. Mrs. Resident was of course cheerful and wanted to get up, saying she's looking forward to a cup of coffee and some toast. The caregiver went to get the transfer belt off the chair beside the bed, and Mrs. Resident said there's no need to use it. She's more than capable of standing up with a little help. The caregiver tried to insist that Mrs. Resident's care plan stated the transfer belt must be used, and she was told, "I said leave the damn thing where it is." At this point, the caregiver said she would need to get some additional help and exited the room, saying that she would return in a few minutes. What do you think? Was it a risky situation? Was the caregiver right to exit when she should? Or should she have just tried to muscle through the situation and possibly risk injury to herself or Mrs. Resident? Let us know what you think in the comments. But in the meantime, you can check out this video here on how to perform a single person transfer. Please remember, you have to take care to give care, and part of taking care is proceeding with caution.